Hi, I'm Toby Kurien. I'm an engineer at the IBM Research Lab, and I also look after our makerspace.
And what is the IBM makerspace?
So we decided that we needed a makerspace in our research lab for two reasons. One is that we want to be able to prototype technology, do some rapid prototyping and development of our own sort of IoT sensors, wearable technology, and so on for our research projects. But the second reason is that we're also part of a precinct that is called the Chimalofon Precinct, and we have lots of startups, and we have our own sort of startup program and entrepreneurship program where we'd like to get the startups enabled in terms of technology. So we want them to be able to also use the equipment, the kind of equipment that you'd get at a hackerspace.
And what type of equipment have you got in the space?
So it's mainly rapid prototyping and electronics prototyping equipment. So we've got, for example, soldering stations, we've got Arduinos and Raspberry Pis and lots of electronic components. But we've also got 3D printers that were locally designed and manufactured. And these allow us to then try lots of different form factors and things like that.
You're doing work on tracking with sensors. Give me a couple of examples of how this work is developing.
Okay, so we decided we had a project where we wanted to figure out how tuberculosis spreads within a community. And one of the challenges there is to figure out how people interact within a community. So we wanted to build some sort of wearable device that we could use to sort of figure out how this community interacts with each other and the geography that they live in. We looked at various off-the-shelf technologies like RFID tags and smartphones with GPSs, but for various reasons we had to develop our own solution, which is a very simple and cheap wearable sensor.
And how much is the tag?
So we're looking at something like around $5 a tag in the sort of small quantities that we're making, but it could be cheaper in much larger quantities. Yeah.
And so how have you used it in a community to discover something?
So what we do is we sort of give it out to a random sampling of volunteers in a community, and then we also place some tags within known locations within the community. And what that allows us to do is figure out how people interact with each other and with the various spaces that we've tagged within that community. That helps us build a sort of graph of where people hang out, what are the hotspots, who are the people that go across different clusters of people or even across communities who might be potential carriers of disease, for example.
You're also using it in treatment processes, aren't you? Describe how that works.
So we basically are using it to figure out how patients travel through a clinic and how they interact with nurse staff and doctors, and how long they sit at waiting areas, how long it takes for them to pick up their medication, and so on. And what that allows us to do is collect a lot of data about how different types of hospital or clinic visits lead to different wait times and hence cost to both the hospital and to the patient.
And you can feed that then back to national government?
That's it, yeah. So the main reason why we want this information is to feed it back to the healthcare, the government, so that they can figure out how much to budget for different types of diseases and the general healthcare budget, yeah.
And you've been working with one hospital that's been using this to make the processes more efficient.
That's
Describe that to me.
So we've got a partnership with Helen Joseph Hospital. They've got a clinic specifically for tuberculosis and HIV. So we've started running trials at the clinic, and once we have more details, then we'll make them public.
But that hospital has also gone paperless as part of it.
Yeah, so the hospital's pretty forward-thinking in the sense that they were one of the first clinics to actually go paperless, at least the clinic that we're dealing with. They went completely paperless, so patients don't have to stand and wait for a physical medical file and pass that around. Doctors will already have all of the information they need at their fingertips.